Myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department in RPIIT, Technical and Medical Campus, Karnal. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in this video, I will show you the goniometry of the wrist radial deviation and wrist ulnar deviation. So first I will show you the wrist ulnar deviation goniometry. So before checking the wrist ulnar deviation goniometry, we will check the wrist range of motion. So for passive range of motion, stable the forearm and do the wrist ulnar deviation. So this is the passive range of motion of the wrist ulnar deviation. So for the wrist ulnar deviation, the goniometry placement arm will be parallel to the midline and the fulcrum will be at the wrist over the capitate and movable arm will be parallel to the third metacarpal line. Now ask the patient to do the ulnar deviation. So this is the goniometry of the ulnar deviation. Okay, so now I will show you the wrist radial deviation goniometry. So before checking the wrist radial deviation goniometry, first we will check the range of motion of the wrist ulnar deviation. The wrist passive range of motion, the elbow should be stable and place the hand in your hand and move the hand toward thumb. So this is the radial deviation of the wrist joint. Now the gonio alignment for the wrist radial deviation. The fulcrum will be over the wrist over the capitate. Fixed arm will be parallel to the midline of the forearm and movable arm will be parallel to the midline of the third metacarpal. Now ask the patient to do the wrist radial deviation. So this is the goniometry of the wrist radial deviation.